Welcome to Foundations of Global Health Hot Topics. In session 12, we're going to talk about urban health and the importance of urban health to global populations around the world. In the previous sessions, we've talked about at least three of the challenges, the public health challenges that we face in the 21st century. Those challenges include climate change, demographic shifts of aging that are occurring, uh, epidemiological shifts that are occurring around the globe, and now there is the significant challenge of urbanization in terms of global populations and individuals and populations that exist in cities and their contributions both to epidemiological shifts, demographic shifts, and even to climate change. So much of the data that I will present in this session will come from my colleagues and courtesy of the International Society for Urban Health. So first, let's talk about the trends. So the trends that we see here in the light blue line are from the populations, and these are in millions. For more developed countries, which tend to be high income countries, which I prefer to use the term, and lower middle income countries. So we see that in terms of urbanization, individuals in cities in higher income countries will tend to remain about the same. And this is from 1950s and the modeling trends to 2030. However, for lower middle income countries, we see that there's going to be a migration of individuals from rural areas to more urban areas. And in fact, later on, I'll show that most cities are growing in populations are in lower and middle income countries. So the acceleration and growth is going to occur in lower and middle income countries. So this is an interesting article that was actually appeared, or I should say blog that appeared from the International Institute for Environment and Development. And it actually analyzed population growth versus movement. And it looked at major cities from a 20-year time span from 2000 to 2020. And it looked at population growth versus movement. And it actually looked at cities in which their overall population expanded based on actual population growth. And it listed these cities in countries, for example, in Qatar, China, Bangladesh, Nigeria, and the United States. And it found that if you analyze cities based on the actual population growth in which the actual population expanded, you came up with a different list based on the size of the population growth compared to cities in which you had an influx of individuals. And in those cities, the population growth was actually relatively small compared to these cities. So, depending on how you measured the growth of the city, whether there was actual internal expansion based on births or whether there was actual migration that caused the city to swell, you came up with a different list of which cities were actually experiencing population growth. But regardless, we can see that cities are still experiencing population growth. And no matter how you define population growth, cities in lower and middle income countries are still experiencing significant population growth. In fact, from this article, India, China, Bangladesh, and the Democratic Republic of Congo experience significant population growth, whether you're counting for migration or even population expansion based on birth rate in and of itself. So, cities are important in the global context, not because they occupy 2% of the land, it is because of their output. Cities basically are important for four major reasons. Number one, they are 70% of the economic output in terms of gross domestic product. They also have over 60% of the global energy consumption. They also emit over 70% of the greenhouse gases and over 70% of the global waste. So, in terms of impact, cities, in terms of their concentration of populations, have an outsized impact on global affairs, even though they only occupy about 2% of the total landmass in terms of not only their consumption, but also their output. And thus, as people move more into urban areas, their consumption of cities increases and they have more of an impact on global affairs and even on global health. So, cities are indeed the future of global health. With this recognition of the importance of the roles that cities play in the health of the globe, the health of individuals, cities are actually taking a leadership role in the health and development of global affairs. And they're taking a focal point in improving health across national borders more than ever before. They're sharing ideas, forming coalitions, and challenging their national governments to improve urban health worldwide. So, for example, the UN has formed a compact for mayors with over 200 world leaders representing more than 270 million people committed to taking a transparent and supportive approach to reducing urban greenhouse gases. The C40 Cities and Climate Leaders Group is a network of more than 80 of the world's cities committed to addressing climate change because, given the statistics that I showed in the previous slide, you cannot address climate change without the involvement of cities. And then also, there's a recognition that cities have to make it better for individuals to age appropriately in those areas, like New York City. And age-friendly cities are become more has gained steam of recently and has been developed and championed by the WHO. So WHO has worked with over 33 cities and more in WHO regions to create aging-friendly in-cities guide and to define how you make cities more friendly to age well in. Because of the settings of these urban areas, they have very unique characteristics. The four unique characteristics include, for example, their density. They're also very diverse, very complex, and with all these three things, they also have significant pockets of inequity, which we'll discuss. Diversity is a major asset within a city. So, for example, New York is a city of over 3 million individuals. Within one borough, Queens, there are over 2 million individuals that live there. There are over 138 languages spoken, and the top 10 languages are displayed here. Uh, Diversity in terms of cultural richness is something that is actually a significant attribute that is very attractive about New York, and it brings a richness in terms of New York and many other large cities. Diversity necessitates a tailoring of interventions to meet the broad needs of subpopulations, and it brings a richness to the city in terms of culture, in terms of various other things too. New York City is a city that contains 5 boroughs, over 5 million individuals, and it has significant large amount of administrative areas. And because it is such a large and complex city, it requires a lot of different systems, organizations to manage this complex city. So this is an organizational chart, just shows part of just administering this particular city. And this is not even the entire administrative org chart of the city. So this shows you the complexity in managing this large city in terms of the multiple interests and the multiple systems that are needed to keep the city functional. All major cities and even minor cities and municipalities have a level of complexity that requires management in terms to meet the needs of all the citizens of the city. So there is complexity in terms of management in any urban environment. Unfortunately, within all large cities, there is a certain level of inequity. And in many large cities, in fact, your zip code is a better predictor of your health than your genetic code. And in fact, within New York, you can see here that based on the different subway lines, the different disparities in terms of life expectancy. So, for example, a person living here in Manhattan, in Midtown Manhattan, can have an expectancy of 85 years. In East Harlem, 76 years. In Astoria, Queens, 82 years. Elmhurst, 84 years. And so forth and so on. And this inequity actually exists all around the U.S. Some societies are better at dealing with inequity compared to other inequities. But in fact, the next video will talk about Baltimore in terms of the inequity that exists. But inequity significantly exists in significant settings within the United States. And here are specific captions talking about the inequity that exists within New York, in fact. And this is from the 2015 Robert Wood Johnson Foundation, which actually mapped inequity around several cities within the United States.
Something different tonight. We're going to use most of our remaining time to offer you a detailed look at life in one of the poorest sections of Baltimore. Our focus is on Sandtown, Winchester, the impoverished neighborhood where there was rioting this past week following the death of Freddie Gray. He grew up and was arrested there. So let's begin Sandtown by the numbers. It's a community of 14,000 or so people on Baltimore's west side that, like so many others, was hard hit by the loss of manufacturing jobs after big companies like Bethlehem Steel left town. The latest available numbers put the unemployment rate in Sandtown at more than 21%. That's about 4 times the national average. Almost a third of the residents there live in poverty. That's twice the national average. We began by looking at health care in Sandtown. For more about this, we're joined by Dr. Robert Blum, the director of Johns Hopkins Urban Health Institute. The institute is less than 5 miles away from Sandtown. So there's this phrase about this genetic lottery. We don't choose who we're born to, right? But the infant mortality rate in Sandtown is more than 3.5 times the national average. 21 per thousand births compared to 6 per thousand births. So from the very outset of life, we already see a huge disparity in health for a person born there versus the average American. Unpack that for us a bit.
Well, first of all, just to put that in perspective, if Baltimore were a country, we would be 75th in the world for infant mortality, below every industrialized country and many low and middle income countries. We have persistent problems due to lack of access to resources, due to persistent poverty, due to lack of education, due to lack of opportunities, and all of these interact to create an environment where neither children nor adults thrive.
So there's another number we came across that struck us, that is life expectancy in Sandtown. It's just over 65 years, 13 years below the national average. That puts people there on par with folks in Pakistan and Rwanda. What should we make of that?
So what we have is a whole set of conditions. We know today that one's environment, one's contexts drive their life expectancy, drive their health status, and to live in an environment with persistent poverty, we're not just talking about access to medical care. We're talking about access to food and healthy food. We're talking about access to exercise and recreational places. We're talking about sanitation. Our environments, and Sandtown Winchester is one example, but there are many communities like that in Baltimore, where the entire environment, both the physical and social environment, is toxic.
You wrote in the Washington Post recently, quoting now, that teenagers in Baltimore face poorer health and more negative outlooks than those in urban centers of Nigeria, India, and China. So how does this affect the perceptions that they have of the world?
The perception they have, because of lack of opportunity, because of being left out of any American dream, is that there isn't any institution they trust. The focus this past week has been on the police and lack of trust for the police. But there's lack of trust for education, for government, for social services. They don't trust any adult because, in fact, many of them report that they live in persistent fear, in home, in school, in their neighborhoods. Their lives are consistent fear.
So focusing in on healthcare, what kinds of access challenges are there in this neighborhood? I mean, just when I was there in the last couple of days, I met several of these folks who don't have transportation. So for them, even the burned down CVS was a serious problem of where they were going to get their prescriptions filled.
Absolutely. So lack of transportation is a big issue. Lack of healthy food is a huge issue. Many of the people in these communities have to travel miles without any transportation to get to a grocery store, a greengrocer. For many, lack of access to healthcare services. These are compounded by persistent trauma that people in our neighborhoods have. For example, children have, on average, two adverse childhood experiences. This is extreme violence. And approximately 18% say they have witnessed a relative or a friend or someone they knew having been shot or killed. So kids grow up in these kinds of environments. And that kind of toxic stress takes a huge toll on physical health as well as mental health. Mental health issues are a tremendous set of concerns for people, and it becomes intergenerational. It's passed from mother to child or father to child, not genetically or biologically, but socially. And that's the context.
All right, Dr. Robert Blum, Director of Johns Hopkins Urban Health Institute. Thanks so much for joining us.
Thank you very much for having me.
New York City, it's also observed in Washington, D.C., in that there is disparities in life expectancy. based on where you live in approximation to the subway lines. The subway lines are indicated here within these different colored lines. Here's the Potomac River, which divides Virginia or Northern Virginia from Maryland, and here is Washington, D.C. So to approximate here in Northern Virginia, life expectancy is 86. In parts of D.C., life expectancy is 78. And in parts of Maryland, life expectancy is 84 degrees in one county right here near the red line. Another part of Maryland, life expectancy is 78 years. So you have life expectancy that is variable depending on what part of Maryland you live in, what parts of Washington, D.C. you live in, and also in approximation to what subway line you live in, which shows the variability. This is also depicted actually here in life expectancy based on what region or what areas that you live in, which also appeared in an article that was published by a local paper. And life expectancy, which actually was localized to zip code. You can see here it also brought granularity can go anywhere from 54 years all the way to 94 years with significant pockets. As you can see here is the DC outline within parts of DC, and then in other parts of Maryland, being in greener areas, and also in Virginia, just giving you another more granularity and perspective in terms of this urban area. Again, similar to what has been seen in New York City, Washington, D.C., the same disparities that existed in those urban centers also exist within Miami, where we see that there are disparities in terms of life expectancy based on zip code from 71 to 86 in some parts of Miami. Even closer to downtown, we see different zip codes, less than 10 miles apart, which has very significant life disparities. In fact, closer to the Bay, Biscayne Bay, there's a higher life expectancy. And even in northern Miami, there's a high life expectancy. So again, these phenomena exist. I've shown you data that indicates there are disparities in life expectancy that shows that inequity exists in cities. So research also suggests that people living in areas with higher population densities are more likely to experience mental health disorders. So the benefits of actually people who live in urban centers um, and are exposed to green spaces are well documented. And we know that in fact cities are introducing green spaces in urban areas because we know that it improves population well-being. And green spaces we know as parks and other areas. But we also know that there is the ability to use blue spaces to also improve physical and mental well-being. And blue spaces include ponds, rivers, lakes, and other areas. So the evidence suggests that also blue spaces should be part of urban surroundings and urban settings. And that is becoming a new area of focus in urban settings too. So although we can look at health disparities and also look at life expectancy, that does not capture the uniqueness of urban data. So for example, I've shown you the diversity of the urban environment. In order to capture all the domains that exist within the urban environment, the WHO, the World Health Organization, has designed a composite measure called the Urban Health Index. And the Urban Health Index actually has 5 different measures with several domains. Those 5 measures are listed here, include health, environment, geography, economics, and social demographics. And the UHI provides a flexible approach to selection, amalgamation, and presentation of health data. Its purpose is to furnish visual, graphical, and statistical insights into various health indicators. And health determinants within particular geographic boundaries and health disparities with a focus on capturing interurban health disparities. The UHI may be used by public health workers, evaluators, statisticians, program managers, academic researchers, and decision makers to examine the current status of urban areas, to assess the change and effect of the program interventions, and to plan for urban improvements. So, for example, I showed you the more granular data that existed within Washington, D.C. when we looked at sort of the disparities in terms of life and specific life mortality and life expectancy. So this sort of UHI data is very, very important in providing more granularity. As a composite measure, it is not the answer to everything, but it provides a lot of information in terms of at least bound by geography and allows us to start to understand and where the disparities exist and can start to allow us to see if the programs that are being implemented are addressing some of those disparities over time or not, and where changes can be made. The next video actually tells us a little bit about the Urban Health Index and what other measures the World Health Organization has instituted to help cities address urban health.
City populations are growing faster than any other time in history, particularly in developing countries. Decisions related to urban planning, finance, and governance play a key role in determining the health of their citizens. One major health challenge facing cities is air pollution. Whether you're an urban planner, policymaker, or a public health professional, it's important to assess the full health and economic benefits of reducing air pollution levels, made possible with the support of the right tools and guidance. Led by the World Health Organization, the Urban Health Initiative uses available evidence, multi-sectoral competencies, and communication strategies to drive the development of sustainable cities. The initiative uses and adapts existing WHO tools for the local context, which includes applications, databases, guidance, and training manuals. The Health Impact Assessment is a combination of procedures, methods, and tools that offer step-by-step guidance for assessing policies. It makes the best use of quantitative, qualitative, and participatory techniques to produce recommendations which maximize positive health outcomes. It also anticipates potential harmful health impacts of those interventions. Another example is the World Health Organization Global Ambient Air Quality Database, which is regularly updated and currently contains air pollution data from over 4,300 cities. The toolkit also includes analytical software which estimates the health and economic impacts of various policy scenarios, such as AirQ+, which allows decision makers to assess potential reduction in life expectancy, as well as the health impacts on the population related to changes in ambient and household air pollution. WHO's Clean Household Energy Solutions Toolkit guides decision makers in the design of policies for clean and safe household energy. And the Health Economic Assessment Tool estimates the health impacts and cost benefits of walking and cycling, considers changes in road injury risks, air pollution, and physical activity levels. It also assesses impacts of carbon emissions. Other applications are currently being adapted for global use. This includes Greener, which evaluates the health impacts of urban green spaces, and the Integrated Sustainable Transport Health Assessment Tool, which estimates health and economic benefits as a result of shifts to sustainable transport. Well-planned policies for reducing air pollution is essential to improving human health and can bring about additional benefits such as mitigating climate change, improving road safety, increasing physical activity, and help drive sustainable economic development. This requires a joint effort across energy, waste, transport, land use, and industry sectors, among others. The Urban Health Initiative model process and toolkit are a win-win for decision makers working to improve the environment and protect the health of citizens.
Experts now know that in order to achieve healthier urban communities worldwide, we must now improve the built social and physical environments and where people live. This means we must address all of these air factors at the same time. So we just cannot utilize a piecemeal approach in which we only address, for example, housing, without also addressing education or even health. We must also address community cohesion, governance, and transportation, because not addressing all these broad determinants at the same time results in the same issues that persist, in which we have economic deprivation that exists within our urban centers that has existed for the past 100 years or so and leads to the significant social inequity and the significant disparities in life expectancy and significant outcomes that we still see and persist today. Addressing this in a strategic way via the previous slide is a health in all policies approach, and it recognizes that the health and well being of all citizens is essential for the overall social and economic development. Health is an outcome of a range of factors, and many of which are outside the purview of the health sector. All government policies have an impact, either negative or positive, on the determinants of health. And in fact, the impacts of health determinants are not equally distributed among the populations, and health disparities must be addressed. Efforts to improve the health of the population require collaborative government agency and even the private sector to work to develop an integrated, multifaceted solutions, because one solution will not actually solve these issues. These issues are systemic and they took a long time for them to get to this point. And many of the most pressing health issues require long term budgetary commitments and creating funding approaches. And finally, we need to make urban centers inclusive, safe, resilient, and sustainable. In order to do this, countries need to develop a healthy urban policy that addresses broad determinants of health, as I had stated previously. This is an all health policy approach. We need to promote interagency and intersectoral government models at the national level and in a decentralization strategies to city and local governments. They need to strengthen government from governance at the national and local level that includes private sector and civil society. They also need to apply a health lens to infrastructure development because some of the things that need to be addressed from a health perspective outside the purview of the health sector. For example, when they need to consider the construction of sustainable and resilient buildings, they need to also think about the construction of green and blue public spaces in terms of mental health, well being, and health of individuals. They need to also encourage a place based policy strategy, which includes an aging in place policy strategy. They need to think about national and regional development planning to strengthen urban and peri-urban and rural linkages. And finally, and very important, they need to think about mitigation and adaptation to climate change.